So BPDCN, Blastic plasmacytoid dendritic cell neoplasm, is a rare but highly emerging disease that many of my colleagues are starting to find out about. My group and I have been working on this disease, this field, for over 15 years now, and we have 3 exciting and important breakthroughs that I think can provide hope for our patients in the field. One is that we and others have shown that BPDCN is highly CD123 overexpressing. That's a surface marker on all these cancer cells. And so we have already led the first and only approved drug, Tagraxofusp or TAG, exactly 6 years ago to FDA approval. So that drug has been on the market. We've been using it as a single agent with high response rates, particularly in the frontline setting. But what's very exciting is we're working on combination studies, doublets and now triplets, combining the TAG with aza-ven, ongoing clinical trial, or with a Hyper-CVAD ALL-based chemotherapy, also enrolling a clinical trial. So both of those are open and available at our center, and we're looking for patients actively. The second exciting breakthrough is that we found out that a lot of these patients have central nervous system involvement, way more than we thought before and more than in ALL and AML patients, 20, 30% plus of these patients. So we've made the practice-changing finding after my publication in Blood a few years ago to incorporate lumbar puncture, intrathecal chemos. The number is still being debated, but multiple intrathecal chemos for CNS prophylaxis. So that's just to prevent CNS because it's so common, and then more if it's needed to treat. So I think that's a big one to help patient outcomes, particularly lower CNS relapses. The third exciting development has been the development of other drugs in the BPDCN field, building on the CD123 story. There was an exciting drug program that I led called the IMGN632 or Pivekimab sunirine. We published or presented those results in the EHA meeting, published in the abstract guide a year ago, showing that as a monotherapy that had high activity rates in BPDCN, and that trial and data is ongoing. So I think these are some of the exciting updates in the field for BPDCN.